In this 10-minute informative and concise video, we will address clinical data, equipment setup and testing, safety procedures, pre-treatment preparation, after-treatment care, equipment maintenance, and general questions and answers. Be sure to read your instruction material thoroughly, as this video does not cover all aspects of the treatment procedure. It is intended as a tutorial overview and introduction, which only highlights the basics you will need to know. Chapter 1, Introduction. IPL was developed from years of research at the Wellman Laboratories of Photomedicine, one of the world's leading medical laser research institutions. From 2003 to 2009, a long-term clinical study was done to evaluate the IPL for hair removal. Of the 92 patients who participated in the study, 100% showed short-term improvement in the form of growth delay. 89% had long-term improvement, averaging 80 to 90% reduction in hair growth counts at 90 days. Follow-up data at 6 months and 1 year showed an impressive 70 to 80% reduction of hair growth. The relatively few hair follicles which survived the treatments were highly stunted, fine, and lacking substantial pigment. Chapter 2, Equipment Orientation. It is important to fully understand the control locations and the features of your STL equipment before use. Key lock safety switch, pulse counter reset, system status, intensity selector, pulse frequency, IPL status, handpiece jack, protective eyewear, flash tube temperature readout. To prepare for use, insert safety key and turn right. The ideal setting for epilation is pulse setting 3 and intensity setting 2. Be sure to reset your pulse counter before administering treatment. Plug your handpiece into the driver unit as shown. Your pulse light instrument is now live, and extreme care must be exercised while handling this instrument. Chapter 3, Treatment Procedure. Before administering treatment, determine your client's skin type by referring to the Fitzpatrick scale in your instruction material. Clients with very light hair growth, blonde, gray, and red, will require additional pigment in the form of carbon dye before treatment. Be sure to thoroughly clean the skin with ethyl alcohol after carbon dye application. And remember, eye protection is mandatory for both the technician and the client. Deliver 120 to 180 joules per centimeter squared to the client's treatment area for the most effective results. And carefully watch for the symptoms of overtreatment. Chapter 4, Post-treatment. It is normal for the skin in the treatment area to experience some degree of vasodilation. This is considered a sign of success. as the skin is reacting to the trauma inside the follicle pore. The use of a topical lidocaine or aloe gel is recommended. Regrowth after treatment is normal. Most of this activity will be coming from follicles which were dormant at the time of the original application. Follicles can only be destroyed in the early anagen phase, which occurs once every 90 days. Most clients respond very well to a series of treatments over 4 to 6 weeks. 8 to 10 treatments over the period of 90 days produces the most lasting results. Chapter 5: Equipment Maintenance. If you're going to be using this unit on 230 volts, you will need a transformer. Be sure your transformer is rated at least 750 watts. Your SPL handpiece produces massive amounts of energy. For that reason, additional cooling may be required from time to time. The use of a tetrafluoroethane spray is recommended. This spray is commonly available at most office supply stores. It is also known as a non-flammable cleaning duster spray. To prevent lamp failure, never allow your handpiece to exceed 160 degrees Fahrenheit. Please refer to the following demonstration to change your lamp. It is essential that you first wash your hands thoroughly, as oils on your fingers can cause premature failure of your lamp. Chapter 6: Questions and Answers. Post-light epilation can be uncomfortable on sensitive areas. Pre-treating with a topical anesthetic or an ice pack will reduce this sensation. The site-specific trauma achieved by post-light epilation permanently deactivates the follicle tissues. Post-light epilation is a non-invasive procedure which is generally exempt from local health codes which regulate electrolysis. Follicles require a minimum of 32 joules per centimeter squared for effective treatment. Should your system ever need service, just visit our website and click on Technical Support for assistance. Pulsed light may be used for wrinkle reduction, pigmentation problems, scar reduction, and tattoo removal on most inks. The instructions sent with your equipment are intended as an entry-level information source. For additional information, please refer to the textbook Lasers and Lights by David Goldberg.